Hello, hello. Thank you everyone for joining us today. My name is Carrie Williams. I am the Director of Services here at ABCD. And I just want to welcome you along with the team that's on the call in welcoming Alison Tierney with us today. So she's here to talk about nutrition with us, which January is always a great time after the holidays. So welcome, Alison. Alison is an oncology dietitian and nutritionist for Trisha's Troops with their Project Connect, as well as helping people going through cancer with their nutrition and dietary needs. So Alison, welcome, welcome. Please introduce yourself and we'll get started.
Hello, everybody. Thank you so much for having me, ABCD. It's truly an honor to be here. I was just telling the team that I'm actually presenting from my parents' house today, and my parents have almost no magnets on their fridge, but they do have an ABCD one because my mom has thankfully been able to use the services from ABCD before she underwent her mastectomy. So just a note to all the great work that's being done at ABCD, and just thank you for having me. So it is such an honor to be here. I am going to be sharing my screen so that way we can see the presentation. And also, I just want to give a heads up that the team will be moderating the chat, but they'll also be moderating the questions that come through towards the end when we have a Q&A. So the Q&A, hold your questions or put them in the chat so that they can preserve them. And I'll be sure to answer as many questions as I can as we go. But in an effort of time, let's just kind of go ahead and get started. So today we are going to be talking about harnessing the power of nutrition and how survivors can reduce recurrence risk and reclaim strength. And with that being said, just a quick highlight of a few things that we're going to cover today. We're going to talk about why nutrition matters. Even though I may be biased as a dietitian, of course, I think nutrition matters, but really, truly, what does the science show? And why it matters during treatment and into survivorship. Just talk a little bit about modifiable versus non-modifiable risk factors. And the reason that's something that's really important to me is that truly my motto in not only cancer, but also life is control the controllables. And sometimes I like to say control or try to, excuse me, it's control the controllables and try to let the rest go. And I say that because it's really easy for us to want to grab control over every aspect, even though we know we might not have control over certain things. And I say that as a fellow survivor as well. So I totally understand that. But we are going to focus on controlling the controllables. And that is what today's presentation is all about. I'm going to talk a little bit how nutrition supports the body, talk about some evidence-based nutrition principles specifically related to breast cancer. And I really want this whole idea and this whole concept to be focused around fear reducing and empowered choices when it comes to nutrition, because I can also very much relate to the fear that can come from nutrition and when there's a cancer diagnosis. So I want to help try to reduce that for you and empower you with nutrition instead. So from there, and then I'm going to talk about a couple practical tools, ways that you can implement what we're talking about today so that you can hopefully just take, even if you just take one tiny little piece of something that we talk about today, and move forward with it, I think that would be really helpful. And that's a really great way to step forward in what you're working on. And with that being said, there was a quote that I heard the other day that was talking about making changes and so forth, and how the reason why so many of us don't make changes in our life to support our health is truly because sometimes that first step is so embarrassingly small that that holds us back. And I say that meaning that your first step really only has to be really teeny tiny. And if you've ever heard the saying before is make your bed before anything else, it really has to do with one small little change can empower you to make more. So, with that being said, I'm going to be covering a decent amount of nutrition here. And I don't want you to go, my goal of it, even though we only have an hour, is to share as much as I can in that time, but also not overwhelm you with that information, thinking that you need to leave today's presentation and implement all of it today, right? That's not a sustainable, realistic approach for most people. So I just want to make sure I make that note before we move on that take one small piece and then take that forward. And then when you get really good at that one small piece, take the next little small piece and then start adding that. And that's one of the most important ways to really be practical and sustainable with some of the changes that we might be talking about. All right, so just a little bit about me. I shared previously that yes, I'm an oncology dietitian, which means I'm a registered dietitian that's board certified in oncology nutrition, but I'm also a cancer survivor myself, specifically a breast cancer survivor. And I share this image because this image is a picture of me nursing my second daughter in her last nursing session. And this was always a really important thing for me. As someone, I have PCOS, so I struggled with infertility both times trying to get pregnant with my daughters. And in this image, I can tell you exactly what's going through my mind is truly that this might be the last time I ever nurse a child. But I never ever thought that it would be because of breast cancer. I always thought it was potentially going to be related to PCOS and knew that the struggles that we had to get pregnant. But only 10 days after this image was taken in my last breastfeeding session with my last child, I was diagnosed with breast cancer. In my journey, I always tell everybody that all of our journeys are uniquely our own and very different. However, we do have some shared experiences. So within this, maybe you hear some of your own story in it, and maybe some of the procedures or treatments that you've had are similar, but everyone's is different. So mine started out where I was initially diagnosed with DCIS with microinvasion. However, my genetics tested positive and an unknown carrier at that time. And so opted and required to have a double mastectomy. I shouldn't say required, that was my choice, but to have a double mastectomy with deep flap reconstruction. Unfortunately, after was over, my surgical pathology came back that it was not DCIS with microinvasion. It was in fact invasive ductal carcinoma. And after a long story, I actually ended up being triple positive. And so this is a picture of me and my husband shortly after surgery. And then I ended up having 3 months of chemotherapy with targeted therapy. And some of you may have be familiar with that. I'm cold capping in this image, and I was very lucky to have that opportunity. And then finished my cold capping experience, which, if any of you have tried it, is its own experience in itself. And then I think it continued on for 9 more months of targeted therapy and was able to finally ring that bell on my own terms. It was something that I did with my daughters outside of the clinic. And from there, people ask me the question often, were you an oncology dietitian before you had cancer? And the answer is yes. And so I often say that my career took an ironic twist. However, what really led me to want to be an oncology dietitian was this extensive family history of cancer in my family. My grandfather had liver cancer. My paternal grandmother had breast and uterine cancer. My grandmother, which is not pictured with me because she passed away before I was born, passed away from lung cancer. My mom is a two-time breast and one-time thyroid survivor. My godmother, who's my mom's cousin, is a breast cancer survivor. And unfortunately, I had to add myself to that list as well. However, during this whole time, a lot of people will ask me, well, did you change your dietary choices because you got cancer anyways? And I think we all ask the questions, why me? I always say that I go through that Rolodex in my head of, what did I do that I got this? And I think those are really common questions, but I think it's also really important that we never blame ourselves, but learn from those experiences. And so once I finally came to terms that all the things that I was quote unquote doing right were the things that were going to help carry me through my surgeries, my treatments, and now into survivorship. And I really can say from my own personal experience, but also the experience of the clients that I work with, how much I see how nutrition and lifestyle can truly just make this profound impact no matter where someone is in the journey. So once I finally focused on the things that what I did right were actually the things that were going to help me, it was much easier for me to focus on the things like, okay, I'm going to keep doing this because I'm going to feel better as a result. So when I think about nutrition, when it comes to cancer, it's of course, I will be the first to tell you that I am a nutrition nerd. Phytochemicals, vitamins, minerals, fiber, how the gut microbiome works. I am obsessed with all of it. However, when it comes down to it, nutrition for me and for my clients and my passion of teaching about is truly that nutrition is one of the bridges to help us get to where we want to be. And what I mean by that is truly that nutrition can help us feel well. And when we feel well, we can do well. And whatever that means for you, right? Whether that is being able to have the energy to keep up with your grandkids or your kids, or to be able to
So,
someday accomplish the
thank you.
activity that you want to be able to do, those are the things that matter. And so I really like to put nutrition into the perspective that it's not just the vitamins and the minerals, but really truly that something that allows us to be able to live a high quality of life as much as possible after a cancer diagnosis. So, with that being said, let's start getting into more of the nutrition components. And a lot of people will also ask me, what is the one thing you wish more people understood when it came to nutrition or cancer? That's easy for me. And it's that I wish more people were informed about the role that nutrition can play during cancer treatment and into survivorship. This is a piece that I think thankfully is growing in desire to learn, hence the number of you that are on this webinar today. However, it's something that's talked about very little by many of our medical teams. And of course, nutrition can play a role in the development of cancer in the first place, but we are going to be focusing on survivorship here and during the course of treatment. And often through this, I will distinctly always remember when I was working in the traditional cancer center, an outpatient cancer center. I now work in my own private practice of Wholesome LLC. But when I was seeing patients and they would say, why didn't my oncologist tell me any of this? And the truth of the matter is, one, there's multiple reasons, but one of them is truly like your oncologists oftentimes don't have time to be able to talk about this component with all the other things that have to happen in an appointment. But the other component is that most of them, unless they personally seek it out, they don't really know. They're not really educated in nutrition. And so it's been found that only 25% of medical schools offer just even one course in nutrition, and it's not even required by medical schools. And a majority of individuals believe that physicians are credible sources of nutrition information, yet 6 out of 7 medical student graduates feel inadequately trained to counsel patients on diet when they graduate. So there's definitely, we're missing the mark here. And so I often like to encourage people that let your oncologist, and even for me, like I want my oncologist to like know the ins and outs of my treatment, my disease, my all the things, and let the dietitian handle their specialty, right? And so, with that being said, I mentioned my board certification. So, what that requires is you have to be a registered dietitian first, but then you need to have 2,000 hours of documented experience before you can even sit for a board's exam. And then you take a comprehensive board's exam every 5 years in order to be an oncology dietitian. So, that being said, we study this stuff. We breathe and live this stuff, or at least I do. So, where that being said, so I always encourage people to, your oncologist and your medical team is great, but I really encourage people to have a dietitian as part of their team because we can just take it from an entirely different perspective and a way to complement the care that you're receiving from your medical team. All right. So let's dive into this a little bit more. I'm not going to talk too much about the statistics here because I think many of us really know them. Really, from the standpoint, about 13.1% of women will be diagnosed with breast cancer in their lifetime. Thankfully, we continue to see the 5 years relative survival rate increase over time and with a great number of 95.1%, but hopefully we can see this to be even closer to 100%. The one thing that I really do want to highlight here is that we see that the incidence is highest in North America and the lowest in Middle Africa and Eastern Asia. And of that point, too, we find in migration studies, which really means that when individuals are migrating from, let's say, that Middle Africa to North America, we actually, instead of seeing where they originate from, those individuals actually assume the rate of the new country. So meaning that environmental factors we believe actually play a crucial role in the development of the disease. And these environmental factors are going to be things like diet, nutrition, lifestyle, etc. And so this is a key insight in that what we do and how we live our lives actually does play a role in our development of risk or our risk and the development of potential cancers. That being said, I don't think this is something that I have to go through too much in this group, but the different estrogen, progesterone, HER2 positive, but also pre versus postmenopausal status, these can all play a role in where the research lies with nutrition and cancer, but also, as you know, different treatment options, surgical options, etc. Now, before I get into some of the detailed things, I want to let you know and remind you that nutrition research definitely has limitations. And I think what is difficult is that sometimes people are waiting for the perfect double-blind randomized controls trial in order to figure out what's the perfect diet for someone to follow. And truly, to be honest, we're never going to see that happen because in order to do that, you would have to have women several months before they even conceive be randomized into two different diet groups, followed closely, and then we have to study their pregnancy and their offspring and then study the offspring for a lifetime. This is just not a feasible thing, and we won't see this done. So we have to glean the information that we can based on the best qualifying research that we have. But with that being said, there's always going to be limitations. So although the data does pull from a large body, a lot of it could be preclinical, population-based, and there's going to be some inconsistencies. A lot of the data also exists from high-income countries, which is a limitation in itself. Sometimes the studies won't stratify or distinguish between the menopause status when breast cancer occurs. So premenopausal versus postmenopausal are actually quite different because the hormones are so different in the female body. And then, of course, note, we're not going to get through everything, but I'm going to do my best to highlight the key things for you. Here we are in the modifiable versus non-modifiable risk factors. So keep in mind that these non-modifiable risk factors are the things that we cannot change, right? These are things that we have no control over, such as our inherited genes, whether that be a BRCA1, a BRCA2, or other mutations. Those are things that we can't change. As much as I wish we could, we can't. Our race and ethnicity may influence our risk for cancer, having dense breast tissues, how early you developed or went through your developed puberty and got your menstruation cycle, and then also the age of reaching menopause. These are all things that are playing a role in terms of your risk factor for breast cancer and including receiving radiation to the chest. We are not going to talk about any of these things here, really, because these are things we can't change. Over here, we do have insights in the things that we can change to help impact our breast cancer risk, including alcohol consumption, overweight and obesity, low levels of physical activity, hormonal exposures, childbearing, and breastfeeding. And I also want to note that although this is considered a modifiable category, there are some things within this that are also outside of our control. For example, childbearing. I mentioned that I struggled with infertility. I did have my first child at the age of 28, and the biggest age that they find is if you have children after the age of 30, that can actually increase your risk of breast cancer. However, not all of that's within our control. Personally, I would have loved to have kids before the age of 28, but it just didn't happen for me. So I want to make that note is that even though I put this in the modifiable risk category, it's really from the standpoint of generally speaking, these are modifiable, but not in all situations. Of course, I like to reiterate that cancer can happen to anybody. It does not discriminate by these things. It does not discriminate by age, by sex, by ethnicity, any of that. And I think it's important to remember because one of the things that really was hard for me and had to work through my own emotions about it is when I was diagnosed, the number of people that came up to me and said, Allison, you are literally the healthiest person that we know. How could you have cancer? Right. And that I know that was a compliment, but it also really hard to take at the same time. And so, in my opinion, I think it's really important that I'm a big proponent of kind of getting rid of the word of cancer prevention because that makes it seem like we can prevent it at all costs if we just did the right things, rather than cancer risk reduction. And that's really because cancer can happen to anyone and it does not discriminate. Our goal here is to help reduce our risk, and that's at the end of the day, that's the best thing that we can do. So the way that I personally look at it and the way that I looked at it prior to even having my diagnosis was truly coming from a big family history of cancer. I wanted to be able to say that if I were ever diagnosed with cancer, I can say that I did everything that I could with the resources and what was available to me. And I can thankfully look back and say that I think I did. And not to say that I'm doing the exact same things that I was before cancer. I've definitely changed many aspects. But the same thing moving forward, I'm going to be continuing to do the best thing that I can in towards terms of the resources and ability that I have. All that to be said, it's not going to be perfect and it never will. So I want to remind you that cancer can happen to anyone. We're really focused on cancer risk reduction here. And of course, as a reminder that nutrition is only one piece of the puzzle, not the only. As much as I am obsessed with nutrition, I will be the first to tell you that nutrition is only one piece. We really want to look at the whole person, and all of the aspects of the whole person really matter. And those are going to be including in nutrition physical activity, also stress reduction, sleep, risky substances, and then also social community and social connectedness. Those are all things that I think are often not looked at enough when it comes to the physical health of the whole person, because all of them play a role. So again, today we're just talking mostly about nutrition, but there's other parts that really matter. So I'm just going to touch on nutrition during cancer treatment a little bit. Certainly, I don't know exactly where the audience is, whether how many percent are in treatment or in survivorship. But I do want to highlight this, even though we'll spend a more amount of our time on the specific nutrition interventions. So keeping in mind that the role of an outpatient oncology dietitian is to help reduce treatment side effects, which can result in fewer hospitalizations and improve quality of life. And so I remember one time too, I was chatting with a patient and the bay, depending on where you had your treatments or whatnot, the bays are they're not completely private all the time, right? So I left one patient and was walking past, and a woman stopped me and she said, "Oh, excuse me." And I was like, "Oh yeah." And she said, "You're the dietitian?" And I said, "Yep." And she goes, "Well, I denied a referral to you because I thought you were just going to talk to me about fruits and vegetables, and I don't need to know more about more fruits and vegetables." And she's like, "But I think I overheard that you could like help me with other things." And I was like, "Yes." So our role as a dietitian is not just to push fruits and vegetables, although they are important, and you will hear me say them again in this presentation. But truly foremost is to help reduce your side effects. Again, because if we can reduce your side effects during treatment, not only do we have fewer hospitalizations and better improved outcomes overall, it improves your quality of life. When I was going through treatment, I had a 16-month-old daughter and a 4.5-year-old, right? Or 5.5-year-old, right? To me, it was really important to preserve my quality of life as much as possible so that I could be the parent that I would prefer to be, although as you can imagine and probably know that I wasn't exactly parenting the way that I would have loved to parent without a cancer diagnosis. But that was really important for me to maintain my quality of life as best as possible. And so that is what nutrition can truly be about. Research really truly shows that working with a dietitian and focusing on nutrition can help reduce those treatment side effects, but also fatigue, pain, anorexia, referring to the loss of appetite, treatment-related cachexia, which is drastic weight loss that just kind of that is independent of how much somebody's eating, immunosuppression, or how well your immune system is working, your weight or body compositions, and drug nutrient interactions. So there's a lot of different things that we can help with as dietitians. And as an outcome, we see that we have better adherence to scheduled treatment, fewer complications, improved weight and body composition, delay or prevention of disease progression, improved chances of survival, and improved quality of life. So these are all researched benefits of working with a dietitian and having nutrition intervention during the course of treatment. Now, post-treatment, if you're in the survivorship, full-on survivorship mode of this, is truly you can relate that just because chemo's over or radiation's over or you're beyond surgery or whatever the treatment may be, is that we still live with long-term side effects from that. And some can last a lifetime, and some may last a year or 2 years beyond treatment, such as fatigue, pain, endocrine disorders, which really is talking about your hormones and so forth. Weight or body composition changes. Brain fog, anybody experience that ever, right? Dental caries or cavities, cardiovascular or heart complications. Many of the treatments can impact our heart, and then also decreased bone density. So these are things that are really important for our long-term health to address, and nutrition can thankfully help these things. As you can see in this long list, that post-treatment, we can help focus on these and have been shown to have all of these outcomes, such as decreased fatigue, improved recovery from treatment, etc. And can I also highlight decreased healthcare costs? I think, right, many of us have deeply experienced the financial burden that a cancer diagnosis can do, and over time, we can actually help reduce those healthcare costs. All right. Now, when it comes to treatment and nutrition and exercise, there was a study that came out not too long ago that really focused on nutrition and exercise during chemotherapy. And I think what's really important to highlight about this is in the past, we used to, when it came to treatment, we would encourage people not necessarily to exercise, but to rest, rest, rest. And really, the research has totally changed. I did my graduate thesis in breast cancer and exercise and fatigue levels. And we really, truly do see that when exercise is incorporated into treatment appropriately, we can have really great outcomes. And so we're encouraging people to exercise appropriately during treatment as much as possible. This study really focused on a nutrition intervention with an oncology dietitian and home-based exercises versus what we would consider usual care. And usual care would mean no dietitian and no exercise routine. Now, some people would maybe say that this doesn't seem like something that is significant, but we found that the intervention group increased their fruit and vegetable serving by 1 each day over like pre having this intervention, whereas those that had usual care, their diet quality actually decreased. Now, one serving of fruit and vegetable may not seem significant, but during the course of treatment, that is a huge thing to actually see, like at baseline, an increase of fruits and vegetables during treatment. That's pretty impressive. And then also, the intervention group increased exercise by 140 minutes during the week, which is incredible. But I want to also highlight that there was no difference in chemo completion. However, 53% of the intervention group, or the ones that had nutrition and exercise, found 53% had a complete pathological response versus 28% with usual care. So this study is really opening the door to many, showing that nutrition and exercise has really deep clinical impacts. And I hope to see more studies like this and more interventions like this come out. All right, so let's dive in a little bit to the nutrition and lifestyle recommendations for breast cancer specifically. And all of the research that I'm going to share here is related specifically to breast cancer, not necessarily other cancer types. Although these are going to be great recommendations for overall health period. But I wanted to, of course, highlight the breast cancer ones. So first and foremost, this study showed that based on the American Cancer Society guidelines, is that those that had the highest adherence to these guidelines, the nutrition and physical activity guidelines, found a 22% decreased risk for breast cancer overall. However, for those that already had a history of breast cancer diagnosis, those that followed the guidelines closer had a 33% decreased risk for recurrence, highlighting truly that focusing more on these guidelines, even after a cancer diagnosis, can make a really big impact. So just to give you an idea of what those guidelines look like from the American Cancer Society, you can see that it's, yes, those foods high in fruits and vegetables, colorful variety, fiber-rich beans and legumes that I think is often missing from the plate. And a lot of that I think has to do with more of that. I didn't grow up eating beans and legumes, so it's not something that's very comfortable for a lot of people. And so it's truly not necessarily not liking it, but really trying to understand, how do I cook this? How do I make it taste good? And that's one of my favorite things to do as a dietitian, is to highlight not only healthy foods, but making healthy foods taste good. Whole grains, except of course, are going to be a highlight. And then trying to avoid red meats and processed meats, sugar sweetened beverages, and highly processed foods. And of course, reducing alcohol as much as possible, especially in breast cancer. So some of these things seem like, well, duh, Allison, I know all of these things. However, the truth of the matter is most of us aren't applying it, right? So how do we make this come to life in our everyday life? And I'm going to give you some more specifics. So just a reminder, that's what those guidelines were, referring to this study right here, that the highest adherence to those particular guidelines found a 33% decrease of risk of recurrence for those that have already experienced a breast cancer diagnosis. All right, so this is one of, just like the American Cancer Society guidelines, these are guidelines that come from the World Cancer Research Fund and the American Institute for Cancer Research. So this really is a broad global perspective when it comes to diet, nutrition, and physical activity. And what's really interesting about these guidelines is I gave a presentation to a large academic cancer center, and I had about 250 healthcare professionals that were working one-on-one with patients, and ask them how many of them knew the guidelines about diet, nutrition, and physical activity when it comes to cancer. And of the healthcare professionals in the room that work on one-on-one direct patient care, only one or two people raised their hand. Okay. And so these guidelines are out there, but they're just really not talked about. And so I want to be able to share some of them with you today. There are actually 10 different guidelines as it relates to the third expert report. And it's called the third expert report because every 10 years they go through the full body of evidence again and make their recommendations. So there's 10 recommendations and they've stayed pretty consistent throughout the different reports. And you can go in, and I believe the full report is 12,000 pages long. So if you would really love to have some, reading to help put you to sleep at night, you could absolutely download the 12,000 page document and help you help that. However, these are highlighted into their 10 recommendations. So that one of the recommendations is to eat a diet rich in whole grains, vegetables, fruit, and beans. And as you can see, this is the same/similar recommendation from the American Cancer Society, just to show that the major cancer groups around the world had the same agreement on what diet or dietary approach really focuses to help with cancer risk reduction. And I think that's important to note because when we see social media and the media itself and all the different things, we see so many conflicting resources and ideas, but really when it comes down to the research and the data, it's really pretty solid, and groups across the board agree that we should try to have what I would consider a plant forward diet. And that is made up of whole grains, fruits, vegetables, legumes such as beans and lentils. Now, this does not mean that somebody needs to be 100% plant-based or plant-forward, vegan or vegetarian. That's not what these guidelines are saying. If somebody wants to pursue that, absolutely that can be done. But this is not saying that you shouldn't have animal proteins or animal products, but you want your diet to be a majority plant-based. So I like to use the phrasing of plant forward or plant predominant, which really means that you're trying to highlight those whole unprocessed plant-based foods as much as possible. Okay, and you'll see in the upcoming slides that anything that has this yellow little mark is really kind of the takeaway that I want you to have from that slide or that recommendation. There's been a lot of study about dietary fat in breast cancer, and find that dietary fat but more specifically, the type of dietary fat can actually play a role in our risk. So the recommendation overall is to limit our intake of dietary fat to 15 to 20% of total energy intake, and really means like 15 to 20% of your total calories should come from fat. I am not a clinician that is very pro tracking all your food and so that you know all these specific guidelines or these numbers to a T. But I did want to also present this because that's what the data shows. And in this case, when we're talking about reducing the dietary fat, really truly the focus is that it should be focused on eliminating saturated fat. It does not mean that we should be like cutting out all avocados, nuts, and seeds, and really, really great healthy sources of fat. We really want to try to focus on reducing saturated fat. There's a variety of reasons for that when it comes to breast cancer, but oftentimes saturated fat increases the risk of inflammation, which can increase the risk of cancer. That's probably the most simplified reason as to why we want to reduce saturated fat. Saturated fat is most commonly found in high fat dairy products, the red meat, processed meat that you saw specifically in the American Cancer Guidelines, and then also, unfortunately, in the highly processed foods where there's added oils and added fats for shelf stabilization, taste, etc. So one of the goals is to really try to reduce the saturated fat from your diet and focus on whole, unprocessed, more unhealthy, or excuse me, more mono and polyunsaturated fatty acids that come from things like avocados, nuts, and seeds, and extra virgin olive oil, avocado oil, etc. All right. One of the things that I'm constantly dispelling within the cancer community is the idea about fruit. And actually, research is actually looking at, when it looks at the research, they always kind of group fruit and vegetable intake together. So sometimes it's really hard to isolate fruit all by itself in the data. However, the goal is really truly eat more whole fruit. Okay. The way that I teach my girls about nutrition is pretty simple. And from the standpoint, I say, does that food look like the way that it is grown on this earth? Right? Does that strawberry, we have a big strawberry patch in our backyard, and we get bountiful amounts of strawberries for like 4 weeks in June here in Wisconsin. And it's amazing. And my kids love it, right? So when I ask them about the strawberry, I'm like, look at, you pick it right off the plant and you eat it. Like that is the way that it's grown. But if we take the strawberry and we dehydrate it and then we add some sugar to it and we turn it into fruit snacks, is that the most ideal way to consume it? The answer is no. Okay. Doesn't mean that we can't ever consume it like that, but we want to make a majority of our fruit intake whole fruit intake. And the research, because they're in this most perfect package of, yes, it does contain fructose or natural sugars, but it also contains vitamins and minerals and fiber and like this perfect package. And often I'll use the example with some of my clients, right? How many oranges do you think it takes to create like an 8-ounce glass of orange juice, right? And the answer is about 5 oranges, right? Do you ever sit down in one sitting and eat 5 whole oranges? The answer is probably not, right? But we can drink a glass of orange juice in 8 ounces in like probably 30 seconds if we wanted to, right? The whole idea is when we eat whole fruits, not only does, because we're chewing it and it has water content and fiber, it's actually taking us a lot longer to consume it. We have these really natural satiety factors that are going to stop us before we eat 5 oranges. Now, if you love 5 whole oranges, go ahead and great. But my whole point is there's a key difference when it comes to how our body uses that between 5 whole oranges and 5 juiced oranges. So eat more whole fruits. Here are some specific data when it comes to vegetables. And when it comes to breast cancer research, we truly see that there's a lot of data on carotenoids. Carotenoids are a type of phytochemical or plant nutrient that's found deeply in things like sweet potatoes, orange bell peppers, carrots. So when people talk about carrots being good for the eyes and so forth, some of that has to do with beta carotene. So the research is truly recommending that we have those that have higher levels of beta carotene in their blood actually have a reduced risk of breast cancer. However, that doesn't mean that we should supplement with carotenoids. And because supplementation isn't necessarily always a good thing, but truly it means having higher amounts of whole fruits and vegetables that are maybe higher in carotenoids, like a sweet potato, like a carrot, etc., can really make a big impact. I also really like highlighting cruciferous vegetables. Cruciferous vegetables also really top the charts when it comes to nutrition and cancer fighting properties. And these are foods like broccoli, kale, cauliflower, cabbage, that they have these special properties called sulforaphane or glucosinolates. I won't get too detailed into the nuances of that, but they're essentially these really important phytochemicals that are found pretty exclusively in these cruciferous vegetables that have some of the best cancer fighting properties you can find. So if you're going to prioritize certain vegetables, prioritizing cruciferous vegetables and those that have carotenoids like the orange, deeply orange colors can really truly potentially make an impact in reducing our breast cancer risk. And also trying to, you'll see here, add more veggies, especially cruciferous. Now, I know that I said that we don't just talk about fruits and vegetables, but obviously there is this highlight here. But what I want to encourage people to do is simply think about where you don't even necessarily have to change your meal all that much, but how can you add more vegetables to that meal? So let's say, for example, I'll give you a perfect example. Lunch right before this is I had a baked potato, and then I actually put a whole bed of greens underneath the baked potato. So I'm like eating the greens with the baked potato, right? Ask yourself, can I add greens to this? Can I add something to it? Do you have scrambled eggs in the morning? Can you add any vegetables that you might randomly have in the drawer just to amp up the nutrition that you have? Okay, so you don't have to fundamentally change your meals completely, but simply just add little things. If you're having a sandwich, can you add tomato, onion, and lettuce to it, right? You're not necessarily changing the sandwich all that much, but you're just adding to it. One of the best things that people really take away is really focusing on adding before you subtract, right? As much as we would love for someone to reduce their processed meat intake or their highly sweetened beverages, those are all great goals. But if you can really focus on adding some of the things that we're talking about today before you even necessarily take away of those things, I think you're going to have some really great positive impacts that'll actually empower you to make more changes because you're going to start noticing a difference in how you feel. Okay, so add before you subtract and ask yourself the question, can I add greens to that? And chances are you can add greens to a lot more than you normally think of. And also to say, as much as I do love a good old salad, the whole conversation here is not about eating salads for every meal, although they can be great. We simply just want to add more to all the other foods that we're consuming. Okay. All right, so here's just a little bit more data on the when it comes to these breast cancer is that this is the third world expert report finding that consuming foods containing carotenoids might decrease the risk of breast cancer, and more specifically of estrogen receptor negative breast cancer, which is a really great win for some of our survivors that might be triple negative, right? Anytime we can get a win of things that can help reduce triple negative, I mean, that's a huge thing. All right, one of my favorite things, flaxseed and lignans. So flax seeds are actually a type of seed. They look like these, I always say they look kind of like brown sesame seeds if you haven't been familiar with them before. And when you grind them up, they look a little bit more like this. Preferably, we do want to have flax seeds ground when we're using them because we can absorb the nutrients better when it comes to ground. So not that the whole seed is bad, but you're just not really optimizing and getting those benefits. So there was a study that found that having a quarter cup of flaxseed just throughout the month, right, or one slice of flax bread weekly showed a 20 to 30% decreased risk of breast cancer. And really how this has been shown is that Flax seeds contain something called lignans. Lignans are a type of phytochemical or plant-based nutrient that has some really great effects when it comes to cancer. So they have been found to reduce the expression of something called Ki-67. Some of you may have heard of Ki-67 just like in your different diagnoses or whatnot, but really it's a protein marker that focuses on cell proliferation or how fast it like grows and divides. So the higher levels of Ki-67, likely the faster growth of the cancer. So when we can reduce that expression, that's a really positive thing. And also been shown to help reduce HER2 expression or proteins, which many might be familiar with is that protein that's related to different breast cancer types. And then apoptosis is also increased. Apoptosis is programmed cell death. This sounds like a bad thing, but this is actually a really good thing when it's done the right way in our body because our body essentially says, hey, this is a bad cell. We need to get rid of this before it can become something else, right? We're actually constantly, every human is actually like could have cancer cells at any time in their body. It's a matter of what happens to that over time. Does it continue to grow and divide? Does apoptosis happen as it should? So these are all really good things that flaxseed has been shown to do is reduce Ki-67, HER2 proteins, and increase apoptosis. These are all really positive things. Sometimes breast cancer patients might have the concerns of a potential interaction with tamoxifen, and the studies show that there's actually no interaction. So just something to note on there. Definitely ask your pharmacist accordingly. And at the end of these slides, I have all like my references too, so you'd be happy to take that and bring it to your pharmacist and talk about it a little bit more too. So add ground flax seeds regularly. If you aren't regularly consuming flax seeds, I highly recommend just starting slow and steady, like a teaspoon sprinkled onto your oatmeal, added to a smoothie or something like that, and then slowly work up by adding more with the goal of at least 1 tablespoon per day. All right, I'm trying to be mindful of time, but I know that I've reached this topic of soy and phytoestrogens, but I think it's really important to highlight here, and that is that soy does not increase the risk of breast cancer or other hormonally based cancers, or there is no data showing that it increases any type of cancer whatsoever. In fact, it's actually shown to help reduce the risk of many types of cancer. So in that case, we actually recommend 1 to 2 servings of whole soy foods a day, or those that I would consider smartly processed. For example, I would consider tofu a smartly processed soy-based food. It's not in that perfectly whole soybean that we might find that the earth grows, but it has a smart processing feature to it, so that way we can consume it even more. So research has shown, yes, in breast cancer survivors, not just in the average public, that breast cancer patients who ate the most soy actually lived significantly longer and had a lower risk of recurrence than those who ate less soy, showing that it was reducing recurrence risk by up to 25%. And we found this risk benefit reduction in risk in both estrogen receptor positive and TNBC. So again, anytime we can get a win for our TNBC breast cancer survivors, that's huge, okay? Research also shows that intake during childhood, adolescence, and adult life, the sooner we start, we actually can have an increase in our decreased risk. That was confusing. The earlier you start, we actually might have greater benefit in reducing breast cancer risk. So we recommend eating whole or smartly processed soy foods. Just to take this topic a little bit more home, because I know it's a controversial one, and it kind of blows my mind that it is a controversy because there's actually really isn't data showing that it increases risk, but this stems from long-term thoughts back into like the 80s when we were looking at rodent studies. So there's actually not human studies that show increased risk of cancer. So in 2021, there was a review of 417 reports of human data, not rodent data, that found that soy products are actually associated with a reduced risk of breast and prostate cancer. And there was another study done in meta-analysis, which reviews all the studies available within certain parameters, finding that the high consumption of soy products, especially tofu and soy milk, was associated with significantly reduced total cancer risk. So not even just breast cancer, but total cancer risk. And with that being said, a lot of those thoughts about concerns about soy are very outdated, and in that there's actually a relationship to lower risk of cancer. So the practical application and takeaway here is that it's recommended to include tofu, edamame, tempeh, or soy milk to help overall nutrition intake and reduce our risk of cancer. And I think the thing that comes with soy often too is really truly the relationship that tofu, for example, it can be really intimidating to cook with. I did not grow up eating tofu, and I remember the first time that I bought tofu as an adult and as a dietitian, I remember buying it and putting it in the fridge, and then over time, oh, it expired. I can throw it away now, right? So like even I was very hesitant, and now I say my family, we probably make tofu 5 days a week. It's and you can get like 14 to 16 ounces of tofu for $1.55 at Aldi, right? It is and that's an organic tofu. Okay. It's very affordable. It's very easy to cook. There's a lot of great blogs out there and vegan or vegetarian food bloggers that can show you how to make it really easy. And honestly, it's the go-to food for my young kids. So try not to be intimidated because it can be really easy to use. All right, I'm going to speed through some of this. I'm happy to share the PDF for these slides so that way they can be sent out afterwards as well. There is some research to show that women who fast for 13 hours or more can help reduce the risk of breast cancer. There's a lot of things about time restricted eating or fasting, so definitely a caution, especially if you're in treatment. Um, Many people are familiar with the strategy, this recommendation of that unfortunately overweight and obesity increases the risk of breast cancer. So trying to achieve a healthier weight over time is very important. Limit alcohol intake. In 2015, the World Health Organization actually declared that no amount of alcohol is safe for a breast cancer survivor. So if you enjoy drinking alcohol, limit it. Enjoy the glass of wine or whatever it might be, but don't make it a very regular thing. There's some more data here about alcohol. And then exercise. Exercise is something that's huge, especially after cancer, to help with that body composition, balance your hormones. There's so many great benefits of exercise that I'd love to talk about another time. I did summarize all of these guidelines into these two charts. There's another page here. So if you get the PDF, of course, you'll have that all summarized here. And then also I included here as a sample meal plan, meal day of what it would look like to like incorporate all of these recommendations to try to show you that it's actually practical, sustainable, and can be something that can be done. So again, something to take a closer look at when you get the PDF. And putting it into practice and kind of pulling it forward together is that oncology dietitians can play an incredible role in patient outcomes. I feel really blessed to have had the knowledge that I had going into treatment, but all that to say doesn't mean that I didn't have any struggles during treatment. I had to like tell my husband, like, okay, I'm having trouble eating because I was constipated and I don't have a huge appetite. But I promise if you make something, that'll take the like decision and the time away from me having to make it. If you put it in front of me, I promise I will attempt to eat it. Right. So like I was almost like coaching my husband how to help me. Right. And so that to say, like I totally understand the limitations during treatment and even into survivorship about nutrition. But nutrition goes beyond just nutrition, and that is really focused on those bridges that to carry you where you want to be. And patients should really, it's really important that we have an individual approach for you because, yes, these are overall guidelines for breast cancer survivors, but how we implement them for someone or based on someone's side effects or whatever they're dealing with, some of these things might change. So keep that in mind. And I wrote during treatment versus survivorship goals they're going to likely differ because we have very different goals during treatment. And as a cancer survivor, of course, cancer changes everything. And my hope is that we can use an unfortunate diagnosis to really focus on things that are going to help us live an even better life than before cancer. And I know sometimes that's hard to hear or hard to relate to, but there are things that I actually am grateful for about cancer and what it's taught me. And not to say that everything has to have a silver lining or anything like that, but there are some really great things that it has given me, and some of that is perspective on life and what really matters. So with that being said, here are some of my favorite resources and websites that you can check out when it comes to nutrition and cancer. And lastly, if you'd like, if you choose that QR code, I have a guide called Five Grounded Shifts to Finally Feel Confident, Nourished, and in Control. They are highlighting nutrition and lifestyle components. And it's actually a little bit more geared towards the mental and emotional approach to food and cancer, which I think is often not talked about enough. And rather than just like eat this, eat that, or do this, it's more complex than that. And so my goal with this guide is to help people feel more confident and find a great direction and towards of making positive changes. And at Wholesome, we always reward action. So if you get through that PDF and you take the action, we have a little prize at the end. So just to we are all motivated by prizes, no matter how old we are. So just a little note for that. I took up almost every minute that I could, but I am happy to stay and answer questions with whatever is available for the team and participants.
Yeah, thank you so much, Allison. That was a wonderful presentation. We have tons of questions, so I'll try to summarize them as best as possible. And everyone, we will continue to record through the questions. So if you have to go back to work or out of time, don't worry, we'll send the PDF and as well as the recording. But yeah, let's get started with some questions. So I think one of the overreaching themes here is organic versus not organic.
Really great question. Very common question. So when it comes to organic versus non-organic, my simple overarching recommendation is any way that you consume more fruits and vegetables or whole foods, organic or not, that is the way you should consume them. Organic foods, as you know, can be up to 40% more expensive. They're not quite as accessible. If you're joining us from the Midwest or somewhere else cold, that it's -10 degrees Fahrenheit outside, like organic fruit is not easy to come by, nor does it any bit affordable, if you ask me. So with that being said, the, in whatever way you can access it and get it, consume it that way. I'll put a little note in the fact that research overall shows that organic foods don't necessarily have more vitamins and minerals, but they may have more phytochemicals. Phytochemicals are, again, those plant-based substances. And because the phytochemicals are actually tend to be the defense system of a plant, if they are organic or more naturally grown, that plant has to have stronger immune systems or defense systems. So that's why the hypothesis of why they tend to have more phytochemicals. Now, of course, when we're thinking about cancer, more phytochemicals in whole foods, like, yeah, that sounds great. And it is. However, if you can consume more fruits and vegetables in general, that is always going to be optimal. So again, we all have different access, affordability, etc. I don't ever want somebody to not eat a fruit or vegetable because it's not organic, right? Like seems like a silly example, but it's not in some cases. Like I have an organic chocolate bar here or an apple here. Like which one do I think I want you to choose, right? The apple, right? And really truly, so again, bring it to that. There's not enough data to show like, does non-organic foods increase the risk of cancer? There's no data showing that. May there be data someday? I don't know, right? There's a lot to be studied there, but the truth of the matter is more fruits and vegetables matter regardless.
Great, thank you. The next one is really about sugar. So again, that sugar, whether you put it in your coffee or you're wanting to treat yourself to a dessert once in a while, I guess just the natural sugars versus not, and then that saying of sugar feeding cancer.
Yeah, absolutely. So little caveat. I was debating which one I would put on here. On my website, I do have a free download about sugar as well. However, I will talk a little bit. Actually, I have a blog post about it too. But I'll kind of summarize it here in that there is that saying, sugar feeds cancer. That is very simplifying a very complicated process. That isn't entirely paint the whole picture. Research actually shows that it's actually the body's relationship of like sugar and insulin versus sugar itself. So, what I mean by that is we actually see that something called hyperinsulinemia, so high levels of insulin, is actually more related to increased cancer risk than sugar itself. So, what that means is that if we can have a really well-rounded, balanced diet full of fiber and nutrient rich and adequate protein and healthy fats. Let's say you have a cookie after you have this really great meal. Your body isn't going, your blood sugar shouldn't spike nearly that high because you've had a balanced approach. Right. And therefore, if you have that balanced approach, we're not going to have high levels of insulin because your body knows how to work with it correctly. It's hard for me to answer because I just want to like keep going about it, but really truly is that sugar itself is not necessarily what increases the risk of cancer. It's its relationship with insulin. That being said, I don't think anybody would say that processed white sugar is good for us. That's not what I'm saying, right? We do want to try to limit that as much as possible in the diet. And again, having that overall balance. All that to be said, there can be some really great alternatives to sugar. And I am a big fan of like dates. Any way we can sweeten with dates in their whole food form is awesome. I make these what I call cookie dough bites, and they're actually I phrase it, they're actually chickpea cookie dough bites. My kids know there's chickpeas in there, but other families don't. And really, it's made out of by pulverizing whole dates. And then we add a nut butter, and then there's oats in it, and so forth. And really, it naturally sweetens it, but it's not as highly sweet as like a table sugar would be. So it's all about getting your taste buds acclimated to less sweetness. So dates are a favorite. I do like maple syrup and honey from the standpoint of they're still sugar, but they do tend to have a little bit goes a long way. And then when it comes to like stevia or monk fruit, those can be great alternative sugars. I do encourage people to avoid things as much as possible, such as aspartame, Splenda, etc. If you're looking for an alternative sugar, I would look more for like monk fruit and stevia. And then personally, I have the as much as I love using dates and so forth, my personal approach is real sugar, less of it. So whether that means dates or for whole fruits or whatever, like I just want to have less processed white sugar. And I'll be the first to tell you, I do not have a perfect diet. I do enjoy having a treat and a cookie and so forth, but I usually make sure I do it after I've had a really great balanced meal.
Perfect. Um, Another theme here is gluten. So people that can't have gluten or have heard that gluten or whole grains can increase the risk of breast cancer.
Yeah, so overall, that is not true. Gluten and whole grains do not increase the risk of breast cancer. However, there's a little caveat on that is that there are people that do have intolerances or allergies to gluten. They absolutely 100% should avoid gluten. However, this kind of gets into, again, another big topic of discussion, which is the gut microbiome and how healthy someone's gut microbiome is, right? If we have a really healthy gut microbiome, which means that we have the good bacteria outweighing the bad bacteria and supports the whole microbiome. We have way less intolerances or issues with bloating, gas, etc. So if somebody doesn't have celiacs or doesn't have like this particular gluten intolerance, me as the clinician would look at them and kind of assess what does their whole diet look like when it comes to their gut microbiome. Because I've had patients over the years that I significantly remember one that comes to mind who had all of these food intolerances that just seemed to increase as her time went on, right? They weren't these intolerances or allergies that she was born with. And over time, we really focused on highlighting, improving her gut microbiome. And after a few months of like being really diligent about it, she was able to consume nearly all of the foods that she had intolerances to before, because we were able to heal her gut microbiome because she was suffering from something called dysbiosis, which is essentially a damaged gut. So, all that to be said, if somebody has a medical reason or an intolerance reason to avoid gluten, absolutely. Otherwise, if you're like, I feel fine after I eat gluten, I don't really feel any different, avoiding gluten may not be of any real benefit. The only time that gluten is going to increase inflammation in the body is if somebody has that intolerance or that allergy that is known to increase inflammation. Hopefully that helps.
Great. Yeah. Um, okay. The other one would be high fat. So we've got some questions about, milk or different types of meat, if people eat them, whether it's, eating poultry as opposed to, beef products, high fat, organic milk, whether it's organic or not, and just switching those out or how those affect your body and your ability to fight off cancer.
Yeah. So I hear lots of questions within those actual components. I'll try to address it as best as possible and as quickly as possible.
Mhm.
Is that we do, again, I want to go back to the fact of avoiding or reducing saturated fat, right? So typically your red meats are going to be the higher in saturated fats. And that is where we kind of want to try to limit. The third expert report actually recommends reducing red meat to less than 18 ounces per week, and processed meats to have none at all if possible. So that's where I want to send that guidance, where from that standpoint, like a poultry or a fish would be a better choice over a red meat or a processed meat. And the poultry and fish, especially fish, are going to have much lower levels of saturated fat. But you don't necessarily want to be eating like the chicken skin, for example, like where a lot more of the fat is going to be found. When it comes to milk, and this is kind of a complicated question because, like, skim milk, for example, has no fat in it, but it still has 12 grams of sugar and no fiber, right? So that's not really like a metabolically healthy milk, if that makes sense, because that's going to raise the blood sugar much quicker because it has. But then we go to whole milk, and whole milk has fat, and nearly all of it is saturated. So that's not necessarily an awesome choice either. If you can do middle of the road and just consume different options, like maybe a 1% or 2%, I think that's a good middle of the road. When it comes to like overall hydration, water and like herbal tea is always the best choice, right? That's the best hydration choice. So if you're looking at it from a hydration perspective, always choose water. And then there are alternative milks out there, of course. I personally recommend an unsweetened organic soy milk. It has a little bit of fat in it, only like 1 gram of it is saturated. It has fiber in it, and it has the same amount of protein as a dairy milk would have. So if there's no soy allergy or component, that's a really great way to kind of swap. And a lot of people find if they're switching from dairy milk to soy milk, they don't really notice that much of a difference. But especially if they're gonna make their oatmeal with soy milk instead of cow's milk, like that can be a really great way to switch. And then when it comes to organic milk versus not, I have the same opinion of like, just because it's organic doesn't always necessarily mean it's superior because there's some complicated pieces of that too. Okay, I think I fulfilled most of those at least.
You did. I tried to combine them, a lot of
Yeah.
them together. Um, okay, I'm just gonna I'm gonna do two more and then we'll wrap it up. And then again, everyone on the call, you will get the recording and then the slides and access to Allison's website and things like that. So, um, one of the last two are back to the seeds, so chia and flax seeds and things like that. It is a couple people had mentioned that they, because of their hormone receptor positivity, were told not to consume those, and or Um, again, how much?
Yes. So when it comes to flax seeds, have commonly been told because the way, so it is true that soy and flax seeds contain phytoestrogens. That is why people are told to avoid them, is because the belief was if these are plant estrogens, we shouldn't tell people that have estrogen receptor positive cancers that they should be eating phytoestrogens. That was the foundational thought of it.
Mm.
However, the science gets a little nitpicky, but truly, um, so we have a receptor and the hormone. Okay. The receptor is like a lock, the hormone is like a key. Okay. So although phytoestrogens look similar in chemical structure to human estrogen, what happens is the phytoestrogens can actually sit in that lock, can sit in that receptor. But here's the thing is that this is where it gets complicated is there's an alpha receptor and a beta receptor when it comes to estrogen. Okay. So human estrogen prefers to bind or sit in the lock of alpha. When alpha locks are turned on, that increases proliferation of cancer cells in the breast. Okay. So when we have the alpha, the key in the lock, that is where we see an increased risk of breast cancer. There's a beta receptor. When a beta receptor is turned on, it actually lowers the risk of breast cancer. And if some women have heard that there's a big study called the WAVE study, WAVES, that actually showed that in menopause, consuming soybeans actually reduces hot flashes. And the reason is because those phytoestrogens, they preferentially bind to the beta receptor. Like preferentially as in like 1600%, like prefers to be in the beta receptor. So when it sits in the beta receptor, it actually reduces that work of the alpha receptor. So what that means is it actually reduces the risk of breast cancer and other hormonally related cancers while also having this really great benefit of reducing hot flashes, right? And other menopausal type symptoms. So it's like you're getting the benefits of estrogen because estrogen does have some really great benefits for us as women without the negative effects of estrogen, if that makes sense. So when we have soy or the phytoestrogens from flax seeds, for example, they prefer to sit in this beta receptor. Now, then the question is, but what if they don't actually sit in the beta receptor and they instead sit in the alpha receptor? Does that increase our risk? Well, we actually see that if the phytoestrogen is sitting in the alpha receptor, it has a 1/10 weaker, so it has only 1/10 the strength of human estrogen, meaning that again, it is reducing the risk of like estrogen receptor positive cancers because instead of human estrogen sitting in the alpha, the weaker phytoestrogen is sitting in there, therefore decreasing the risk. So when we get down to it, that whole simple concept thing of, well, there's phytoestrogens and plant estrogens look similar to human estrogen. And since I had estrogen receptor positive, I shouldn't eat these things. As you can see, it doesn't paint the whole picture. And that's actually why these things actually have been shown to reduce the risk of cancer. And not to say that what I do is for everybody else, but just for a guidance, like I'm a positive breast cancer survivor. I eat at least 2 servings of soy products every single day, right? And so with that being said, like I feel so confident about the data and the research, and I feel so comfortable about it that I consume that much soy every day, and so do my 2 little girls. And because we can understand that data, and that's why we see such great benefits. So that's where like doesn't mean that all research from the 1970s and 80s is bad, but like that research was based on like the fertility of cheetahs and rodents. Like I'm not a cheetah or a rodent. Like it's so much more complex than that. So I would really highly encourage, especially if that those individuals that were asking that, if their oncology team told them not to consume soy and flaxseed because of their estrogen receptor status, grab the data from here and say, hey, I want to have a conversation about this. Can you look at this with me? Because I'm not saying that you should just like blindly ignore them, but I also think having a conversation is really important because we can show the data. And selfishly, that's a teaching example for the medical team too.
Perfect. Thank you.
Hmm.
Um, yeah, and just lastly, because there's a myriad of people on this call all through our community, I just wanted to ask, it was asked in the chat, that are these recommendations also applicable for people living with metastatic breast cancer?
Great question. And yes, 100%.
Perfect.
Yeah, when we look at like the third expert report, when I mentioned that they have those 10 recommendations, they specifically note that can't that those going through treatment should seek individual counsel because the 10 different recommendations may not be applicable if they are going through current treatment. And the reason for that is not because if they have metastatic disease, they shouldn't necessarily be eating these things from that component. It's more so I'm encouraging fruits and vegetables, but if somebody has diarrhea that's uncontrolled, I don't want them to be eating uncontrolled fruits and vegetables. I want to get their, because of their treatments and so forth, I want to get their side effects under control so that they have improved quality of life, they can preserve their hydration. And so, really, that recommendation is based on the side effects that can happen from potential treatments, might have different interventions. So, it's not because flaxseed would increase the risk if someone already has metastatic disease. It has more to do with their treatment tolerance and so forth.
Okay, perfect.
Mhm.
Well, thank you so much again, Allison, and thank you everyone that joined us today on the call. We're going to wrap now. As I mentioned, we'll be sending this out. If you have any additional questions for Allison, please reach out or reach out to your own team and a nutritionist at your facility. Again, thank you, Allison, and everyone that was here joining today. We really appreciate all of it. Thank you so much.
Thank you, everybody.